So I've had a long history of mental distress. I'd had a few overdoses and suicide attempts here and there. When I was 38, that's when I really kind of crashed, and that was the first time that I was actually admitted to a mental health unit. My name's Donna Matthews, and I'm the lived experience manager here at Barwon Health's mental health, drug and alcohol service. When I ended up getting admitted to an inpatient unit, I arrived on an ambulance trolley, and it was a Friday night, and the ambulance guys just sort of load the trolley, and there I am standing in this lounge room wearing flannelette pyjamas with flowers on them, clutching a bunch of flowers my mum had given me, and it was a really chaotic Friday night. There seemed to be lots of quite unwell people there. There was noise, colour, commotion, all this going on. It was just quite horrific, really. So yeah, finally someone walked past and he said, "Are you okay, love?" It turns out it was a patient, and he just said to me, "Are you okay, love?" And suddenly I was being treated as a person again. And that somehow gave me a bit of strength. What I realised sitting there was that I'd gone in as an educated woman, a mother, a daughter, a sister, a strong, capable person with lots of different talents. But walking through those doors, I'd been reduced to being someone who wasn't well. So I'd had the week in the mental health unit, and then I had to go back to work. And that was the hardest walk that I've ever done from the car park to walk up to the front doors of my work. I just so didn't want to be there because I was worried about people asking questions. I was scared of people's reaction if they knew, but what I found over time was when you're brave enough to be honest yourself, you'll find that often other people are in similar situations. So that was the start of me kind of coming out from the shadow of stigma and prejudice. Unless you're the person sitting in that bed, in a general hospital or sitting on a mental health unit, you don't really know the quality of the service that you're providing. The wonderful thing about lived experience and peer support is there's no expert in the relationship. We're equals and we're learning from each other, and you support each other on the good days and the bad days. I think it's important to break stigma around mental illness because you never know if one day it's going to be you. We need to be accepting of people who have what are called personality disorders, or people with bipolar, or people with schizophrenia. We need to be accepting of all of these people and realise that many of them are in high-flying jobs, they've got families, they're your neighbours, and just break down that stigma so that there's no shame. Because the worst thing you can do when you're feeling unwell and distressed is to be carrying this burden of shame with you as well.